The federal government is weighing deep cuts to HIV prevention funding, a move that could have serious consequences for communities across the country, including right here in the Coachella Valley. For decades, DAP Health has been at the forefront of providing life saving care and prevention services. I spoke with CEO David Brinkman about what's at stake and how the organization is preparing to respond. David, thanks for talking with me today. Everybody's been watching the news about the federal cuts that are being planned around HIV prevention. I think it's an important time for the community to hear what DAP Health is planning.
The federal government today is considering drastic cuts to CDC prevention funding, in fact, wiping out the entire program. We have made tremendous progress in the last 40 years towards ending the epidemic. We project that if these cuts occur, we will see 44,000 new infections. Any federal cut to the Coachella Valley will mean that the highest risk people for contracting HIV will not receive education, free testing, access to condoms, and the wraparound services that our STI clinics provide for free. Right now, our focus is on preventing new infections. Cuts will lead to new infections.
Beyond domestic funding, federal dollars also fuel the global HIV response. The U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, has saved millions of lives since its inception. But with recent cuts and pauses in U.S. foreign aid, the future of HIV treatment and prevention efforts, both abroad and here at home, is in question.
We are so fortunate, both in the United States and until recently around the globe, that we have had an international plan to end the spread of HIV. Progress has been significant globally. As we know, in the last few weeks, PEPFAR has been cut. And so people around the globe will not have access to HIV medications and will die from having HIV. In our country today, antiretroviral therapy and PrEP are both the only successful method to keep people virally suppressed and healthy and to ensure that the virus doesn't pass. We have the methodology, we have the science to end the epidemic within our lifetimes. To think that that could be threatened as we are seeing it around the globe is unbelievable. So we've heard from the federal government that they believe that they can push off the cost for HIV care to state governments and local governments. But the truth of the matter is, even the wealthiest states in our country cannot afford to provide that care. Any federal funding cut to DAP Health impacts people in our community who day to day are working two jobs, sharing one car, raising a young family, and simply trying to make ends meet. This is the population of people who are not buying eggs today, right? And this is the population of people that we provide preventative care to. When we're not providing preventative care, people are forced to go to the emergency departments to get their care. Emergency department care is 2 to 3 times the cost of preventative care delivered at a health center like DAP Health. In the face of uncertainty, I know that our patients are concerned. I want you to know that we are committed to you. We have been committed to caring for this community for 40 years. This organization is going nowhere. We will be here with our doors and our hearts open to care for this community, come what may. We are so fortunate to be in such a giving community. When I think about our volunteers, our donors, and our staff who show up each and every day, it is a reminder that tomorrow morning the lights will come on, the exam rooms will open up, and patients will be welcomed into care.
In 1981, President Ronald Reagan made significant budget cuts to balance the federal budget. That decision led to a fundamental shift in how nonprofits raise funds, amplifying the impact of individual donors. On March 29th, DAP Health will host the 31st Annual Steve Chase Humanitarian Awards, or the Chase, highlighting the impact individual donors make in our community.
With public funding increasingly uncertain, our private donors in the Coachella Valley are critical to our organization's ability to respond. Regardless of what happens in Washington, Local donors get to choose the impact in their community. And through giving to organizations like DAP Health, we are able to provide services to those who have the greatest need, oftentimes people who are on the margins of our society, whether it's a young mother who's getting ready to deliver her baby, or whether it's somebody who's a farm worker in our community who has diabetes. Our programs are for the community members who need it most, and our donors enable us to deliver that care.
Healthcare matters to the 88,000 patients served locally by the organization. And as federal funding decisions hang in the balance, DAP Health is working to protect that access. For NBC Palm Springs, I'm Stephen Hankey.